Lymphedema is an abnormal collection of tissue proteins, chronic inflammation, and fibrosis caused by a compromised lymphatic system. This system can be compromised due to a congenital problem or acquired due to damage to the lymph nodes or vessels. There are hundreds of lymph nodes in the body that filter lymph fluid. The lymph fluid contains water, proteins, and cellular debris, so the lymphatic system is where the body filters the waste products from the cells and removes them from the body. If it's not working properly, the system backs up and you have lymphedema. I've heard the system compared to an oil rig where the nodes are the pumps and the vessels are the pipes. Therefore, if you've had lymph nodes removed due to breast cancer, for example, there aren't as many nodes or pumps. To remove the fluid and then it can get backed up. And the backing up causes swelling. Now that it is swollen, what do? You go to therapy. Now that you know what is going on, therapy can help improve the swelling. What therapy wants to do is get the swelling down as much as possible. We do that in a couple of different ways. If you haven't been to therapy, we love exercises, so of course we're going to give you exercises. They are very easy exercises and can be modified to ensure you are able to do them without pain. Pain is not wanted with any aspect of treatment, as it is a trigger to your body to increase inflammation and thereby making your lymphatic system work harder to clean up the excess fluid. The exercises are to improve the circulation of the blood flow and muscle pump to assist in moving the lymphatic fluid. I have patients do them in a certain order to clear out areas so the affected area has a place to move the fluid to. We also do a special massage to assist in moving the fluid. Again, clearing out the areas away from the affected area so that when you go to the affected area, the fluid has a place to move to. It is a very light massage, and we can teach the patient to do it themselves as a part of their long-term maintenance plan. Another part of therapy is bandaging. We use short stretch bandages with a multi-layer system to decrease the edema. When the swelling is improved and plateaus, we measure for the garment. You don't want to get a garment when you are really swollen because the garment won't decrease your swelling. It will not let you get larger. So if you get a garment when you are as small as possible, it will keep you in that area. Getting a garment is the ultimate goal of therapy. There are many types of garments available, both custom and ready to wear. There are a variety of sizes, fabrics, and colors to choose from to find out what works best for you. Unfortunately, lymphedema is a problem that is managed and not cured. If you think about it like high blood pressure, where you take a pill every day, if you have lymphedema, you get to wear a compression garment every day. Garments are worn all day and removed at night. In some cases, bandaging is required at night also to keep the swelling down. So it's important, as with any medical problem, to try to prevent getting lymphedema or making it worse. In general, you want to decrease any irritation to the area. Irritability causes inflammation, and with a compromised lymphatic system, the inflammation can lead to edema. In the same way, you want to avoid any infection, as it can overload the lymph system and increase edema. Perform good skin care. Keep the area clean and dry thoroughly. Apply moisturizer daily. Be careful with nail care and do not cut your cuticles. Protect exposed skin with sunscreen and insect repellent. Use an electric razor to avoid nicks. Don't have blood pressure or IV sticks to the affected area. Avoid injury or trauma and wear gloves during activities that may cause skin injury, like gardening or doing the dishes. Avoid carrying a heavy bag or purse on the at-risk limb. Avoid extreme temperatures. Avoid prolonged inactivity. Wear loose clothing and jewelry. Avoid heavy lifting. Wear compression if you're going to fly. Even if you do everything you can still have an exacerbation of lymphedema. Sometimes you may need to return to therapy. Luckily, we are always here to help.